Hey guys, thank you very much for your support. This is my second video. I was in fact overwhelmed by the kind of response that I've got. It's like I received like more than 500 views and 100 subscribers just after a day of publishing my initial video. Hats off and thank you to all of you. This session, I'm primarily going to focus on the target audience, which are our students. A neophyte, a novice to medical coding, so especially the graduates, right? Either mostly diploma holders are not coming, so we find only graduates in all walks of life, from life science, from medical science, from paramedical and all that. So we are getting our students. This session is a guidance for those students who want to carve a niche into this industry, which is the medical coding industry. I'd like to tell them, after completing this formal education of 10 plus 2 pattern plus a 3 years degree or a 4-year degree course, from the professional side we have like 4.5 years too. When they enter into the realm of medical coding, they are clueless. How it operates is pretty simple. First thing is, you need to join any training institute which offers a course in medical coding, and this would run for 1 or 2 months. Depending on the caliber of the students and the foundational courses which they have already studied in their college, the duration will vary. But I don't think that training institutes offer a kind of, a tailor-made approach to the students. They have a fixed training schedules and time slots available. It is not feasible from the end of these training institutes to run an individualized training program, right? Considering the fact that as graduates, a 1 to 2 months training is sufficient to enter into the field of medical coding, where you will try to know the basic thing like knowledge of medicine. So the language of medicine is a basic thing which is being imparted to the students. So that is at the entry level training. Get enrolled in any medical coding training institute, get a certificate, okay, and then you can approach or you can go for interview to as many training companies. Perhaps the training institute is providing you a placement, that's fine, but I don't think that works all the time. Please don't rely on the training institutes for placement. I myself have seen several students approaching me saying, "Sir, would you give us a placement?" I would tell them, I'm not a placement agency. I'm only a training agency, but I would give you the degree of confidence that you can tackle any kind of interview. What is needed is the knowledge. If you have the due knowledge, you can certainly, crack any type of interview. What do you encounter in a basic training program? In a basic training program, maybe it would go for like 3 to 4 hours. That depends on the training institutes. The courses or the subjects that are being taught are like medical subjects, human anatomy, human physiology, pathology. I don't think embryology is also needed. These things, anatomy, pathology, physiology, along with the basic coding manuals, an introduction to the coding manuals like the ICD-10-CM for US healthcare and the CPT manual. Along with that, you will be exposed to that HIPEX book as well. So these 3 books you should be exposed to. First, to talk about the ICD-10-CM, just an intro. I'm not going to dwell much about it. About diagnosis, you are going to please see my prior video so that you will have some idea of what I'm talking about. In the ICD-10-CM manual, the diagnosis codes are reported. Why you are going to meet a doctor? Why do you come to the doctor's office today? So some is medical problem, right? So that would be your, say, diabetes. You went to a doctor to check your diabetes, or you find like you have polydipsia, your thirst is elevated and frequent urination, so you want to have a change of meds. So your encounter is for a diabetes management. So your diagnosis may become diabetes mellitus, type 2 or type 1, whichever it is. Go to that manual, figure out the ICD-10 code for that. And what does a provider do? Did he give you any insulin charts? Did he made any plan of care? Did he change any of his medications? Did he alter the medicines? Things like that. After doing it, so you have got the procedure code, the ICD-10 code, if there has been any medicine being prescribed to you, injection being given to you, or any advice, any health advice or clinical advice, and then you leave the doctor, right? So this is how it happens. So you should be knowing to know. It's not that you should be knowing to code the conditions and pick the procedural service. Not like that. At least at an introductory level, you should have a level of comprehension and understanding where to locate what. So that would be more than sufficient. So you should be knowing the diagnosis concepts in depth. What are the coding conventions and rules that govern the selection of these ICD-10-CM codes? That is needed. So you should know the background of the ICD-10-CM, what it is all about, and how it differs from country to countries, and what are we doing in India. Maybe this would help you some extra knowledge about where we are standing actually. Having said all these, you know this anatomy, physiology, pathology, medical terminology, all these you learn. Good? Fine, that is at the entry level. Most of the students would look out for an employment right after their graduation, because it is an unwritten norm that the students have to look out for a job the moment they come out of college. But I totally understand the social setup or the economic status of the students are looking out for jobs, because finance plays a major role in our life actually. It is finance that determines our status of living too. So considering all those factors, I would like to give some ideas and advice to the students. When you look out for such training coding in institutes, please know the qualifications of a trainer, because I have seen training institutes where the trainer was not even certified, but classes were being taken for the certification exams. It is a paradox. And I remember 2 of my students complained to me like they actually subscribed for an examination, an advanced certification level of training, but then they came to know that they weren't trainers to do that certification training. So please don't be misled. Take some time, that's okay. There will be so many institutes out there, and if you just browse into medical coding, you might get incessant calls from those training institutes. I totally understand, because that's all we all went through and you also will go through. It's not just because there is a crowd in an institute, it doesn't mean that it teaches well. No, it's not that all that glitters is not gold, right? So make some scrutiny, make some scrutiny underneath. I want to give one heads up about these training of these medical subjects, especially if you take anatomy for instance. Honestly, I learned anatomy for 1.5 years, because the first year was 1.5 years. So anatomy, physiology, the basic subjects would be learned for 1.5 years. That's what I went through. It's my personal experience. After an undergraduation, you have something called MSc in anatomy, or at least 4 years you can learn anatomy alone. Same way, physiology. So what I'm trying to say is, so we can't replace medical colleges. Those are professional colleges, professional exams, professional study. We can't replace that. But in this duration of 2 months, we'll have to teach you anat, physiology, pathology, and medical terminology, plus these coding subjects. So please understand the seriousness of it, because it's not just the trainer's responsibility alone. You also have to learn so much from your end. These terminologies are not that easy as you think, because these are Greek and Latin. Of course, these are Greek and Latin words, right? When I say inflammation, what are the signs of inflammation? Rubber calidolor, functionalesa. These are the classical signs of inflammation. You need to know what is a rubber calidolor functionalesa, right? Rubber is redness, tumor is swelling, calor is heat, functionalesa is loss of function. So these are the signs to show that this particular tissue has been inflamed. Why I'm trying to say this is because you need to learn certain things in order to make yourself equipped. We would say, right, sweat in peace so that you don't have to bleed in a war. You can't go to a war without a weapon. So when you go for an interview, you'll have to equip yourself. Your weapon is your knowledge. So learn as much as possible right now. Okay, so learn the basic coding concepts, the ICD-10, the CPT, the HIPEX, the medical terminologies, whichever, and other, if any materials being given about insurance companies, learn them. Some medical billing concepts, learn them, fine. So the next level is at the company level of training. So you go for an interview and you crack the interview, you are being selected as a junior medical coder or junior medical officer in a company. There, after induction, you will be given a certain amount of training about the HIPAA rules, certain norms, how to work in a healthcare industry. Plus, you will also be imparted the knowledge of a client-specific training, a project where you are being assigned to. So this training will be offered by your company where you are being deployed or recruited. Okay. So this kind of training is something which is given within the company. So you don't have to have an extra knowledge, or you don't have to look after certain seek the assistance of a training institute for that purpose, because now you are being recruited. Now it's just follow the rules that are there within the company, plus your project or your client specific guidelines. Thirdly is your exam level training. After working as a coder, you might be working as a coder and you see your fellow people are certified. So at that time, what you have to do is prepare yourself for a certification exam. Okay. The moment you join, maybe from the second or the third one, start looking out for exams. At this point, you definitely need the assistance of some training agencies. Here it happens in two ways. One is, maybe your company can offer you the training and they can also sponsor for the exams. Some companies in Chennai offer that. Whereas most of the billing companies or some smaller companies don't have the capacity to sponsor for the exams. So you will have to write the exams from your own pocket. But if the company is providing you the certification exams plus the training, you will be put under some kind of a legal agreement or a contract where you cannot leave the company for a stipulated period of time. Or if you want to do that, either they will cancel the certification, which I think is improper, because no matter the company is sponsoring the exam or making the students train, the student is writing the exam. So what is the credit for that? So they will have. So my humble request is companies have to seriously look into this kind of a pattern, or students should not encourage this kind of a contract, because you write 6 hours of exams, you prepare, you study well, but you are in a position where you couldn't serve there for 2 years or 1.5 years. So maybe they can ask for the monetary benefits, whatever amount they've invested in training as well as for sponsoring the exams, but not for removing the certification, cancelling it. I don't think that is professional in the first place. Okay, so this is your certification or the exam level training, where either you have to spend from your pocket or the company can sponsor you. Definitely, so your training timing would be maybe at the end of your work, end of the day, after 1 to 2 hours, or it could be you will attend the training sessions during the weekends. If you opt for on a personal note, if you want to join some other training institute like Dr. Ram's Academy, maybe you can come in the weekends and then you can join the classes. So please choose. If you have your financial needs being met, then you can spend for that. If you think that you are not financially stable, then you can definitely seek your company's privilege, whichever they offer you. The next level or the fourth level would be aiming for a specialty credentials or for a higher exam training. Say you have been working in a radiology, or you have been working as an EM coder for so many 1 or 2 years or 3 years, or an ED coder, then start cracking those exams. Take up the ED exam, take up the EM exam, or the radiology, whatever specialty you are currently working. Or if you think that you are a little worked, you have the confidence, then take up this auditing credential. Because I have seen persons, coders especially, even after 6 years, they haven't been certified. If you listen to the reason, I really can't tolerate it. What they would say, sorry, I didn't have the money, I was not financially stable, I couldn't spend so much. After 6 years also, they think that they are not willing to invest. See, unless you invest, it's an investment in education, right? It's an investment in education, it's an investment for life. Your education will never go waste. So please don't hesitate to invest in education first of all. Take the exams as soon as possible, as much as you can, because you don't know how the future years are going to be. You would be more busier than you are right now. Okay, so the final stage would be auditing. When you complete like compliance, auditing, higher specialty, definitely. And one thing I would say, it is not just the certification exams. You should also display your expertise, right? When there is a client call or when there is a conference, you are being called, to expose, to explain, to elucidate on one particular project or address a client who has come. They ask for seminars. If that is the case, if they want to proudly say, yeah, here he is my auditor or he is a compliance officer, you should know how to display your professionalism by way of your knowledge, the amount of ideas that you share, the risks of being in a healthcare industry. It's like standing on a dynamite. It is not that as easy. Many are unaware, many are ignorant of the rules and regulations, but it is not so that it's not that easy, I'm saying. To sum up, these are all the various levels of training. As we saw, the basic or the entry level training, get trained from any medical coding training institutes which are proper, which are professional, who don't mislead or misguide you. Arts, non-science, engineering, commerce, history, all those people, beware, you won't get a job unless you finish the certification. Please believe that. That's what I don't want to further damage you, or further I don't want to traumatize or agonize you, because this is a fact. You'll be misled, because many Mac students say, sir, that institute, they said they'll get me a job. That is not proper, yaar. See, you are a mathematical person from a mathematical background. What do you know about medicine? Eventually, I want to conclude by saying how Dr. Ram's Academy can help you out, because I want to do something to my community, to our people, or to our coding community, or to our prospective coders and billers. I want to do something. So we have various training modules being lined up. As said earlier, it's an entry level training. So we have entry level training. At this entry level training, what I'm planning to do is like, I'm going to give the training free, it's like especially for this graduates, So we will be publishing our videos on the subjects of medicine, which is anatomy, physiology, pathology, ICD-10-CM and CPT manual. So whichever subjects, these are actually the subjects, core subjects that are being taught in a medical coding training institute. It's not my intention is not to hurt anybody's business, but I come with a pure, intention. And the real intention is to serve the poor and the needy people, because with this impact of COVID, it's not that kind of an offer we want to give. It's not an offer. It's an assistance which should be beneficial for our students who have, who are not financially stable or economically stable to get a course and all that. So for that, please continue watching all of our videos, because I will be giving each and every topic in the basic medical coding, starting from medical terminology, the foundational medical subjects. So everything will be given as public. So please subscribe, please share, please read whatever is there. If you are sound, if you have really learned the entire concepts that are being taught there, it will be very laborious, because the concepts are not that easy as you think. It takes so much of time. So please watch all of our videos. So this would amply equip yourself so that you can certainly clear any kind of interview in any companies, in the sense for freshers. If the company is looking out for fresher, and if you happen to watch all these training videos which we are giving it as a free service, certainly you can crack the interview and get a placement. See, UPC exams are given for free. IAS exams, administrative service, police service, foreign service are given as online. So why can't this, right? So we can please certainly make use of this. Everything will be hosted as a public view, so that, because you don't have to have the problem of relocation, migration and all that factors. Please have your mobile phone or good internet facility. Just watch all our videos, because this entire basics will be free, and that This would certainly give you the confidence to go and any interview. But if you need that, you need to have some extra learning or some more amount of inputs, because definitely I agree that no matter whatever you read in that seeing online, it can't replace face-to-face classroom session. But this would certainly help the needy ones, people who are there in the remote or vulnerable places, or who can't really get access to quality training. Definitely this would help them in a greater way. And for the company level, second level of training, I don't think any training institute has a major role to play, because that totally depends on the team where the coder is being assigned. So now this is within the scope of the manager and the team leader who's taking in charge of this particular project where this coder is being inducted. Okay. Thirdly, at the exam level, yes, for the basic exams, at Dr. Ram's Academy, we provide the training. And many people ask, who is a trainer in your academy? So I want to give, it's my humble exposure. Like, I want to tell you that I'm the person who is taking the training. So all our training program is like, they're all online. So everything is made online. So wherever, which part of India, if you're there, because once we were not giving out this earlier, many people from other states also reached out to us. So we were not in a position to give them the training. So having gone online on digital, so this would certainly help them in a bigger way. So our basic training modules is also being available online. So anybody can subscribe, anybody can get enrolled in it. There will be like 25 classes at least for the basic training exams. And that would certainly give you the confidence. Once you keep watching those videos often and often, definitely you will learn the concepts well, and you will certainly crack the exam with flying colors. Medical billers are taking up the basic examinations. Okay. As medical billers are taking up the exams, it's good because they spend their nights and they come the next day. It is so pathetic. Some people, out of hard work, after working for so many hours, it's really strenuous for them for a row of 3 hours together stretch. Some doze off. It's not that I am just mocking at them. No, never at all. I have huge respects for them because of their seriousness that they want to learn and climb up the next ladder. So when a medical biller learns this, he will complete that RCM cycle. He can certainly claim himself an RCM expert. So medical coders have to go to the next level. So please take up these credentials, higher exams more and more, so that you can elevate yourself. Otherwise, you'll be nowhere in the race. Okay. So I don't want to take much of your time. So this is what I want to convey, how this training strategies takes place typically in a medical coder's career. And Dr. Ram's Academy can help you out in all these ways. Okay. If you have any feedback, any suggestions for improvement about this, publishing this video, please let us know, because we are just still in our nascent stage. We are also learning many things, how to improve. And finally, please subscribe and share. Your support is highly appreciated, and we welcome your warm feedbacks. Of course, even if there's anything negative, that is absolutely fine, because we can't learn or we can't improve without making mistakes. Okay, thank you so much for watching. Please subscribe and share. Thank you.